Poll-evil bursitis of the atlantal bursa. Poll-evil is a condition med within horses, resulting from bursitis of the atlantal bursa. The atlantal bursa is an acquired bursa found between the dorsal arch of the atlas and the funicular part of the ligamentum nuchae. Closing parenthesis. Etiology. 1. Repeated trauma. 2. Bacterial infection. 3. Parasitic infection like onchocercosis. Symptoms. A lobulated, fluctuating swelling behind the poll. The head is held high up, with the nose pointing upwards, to relieve tension on the bursa. When the horse is made to walk, it keeps the head steady and stiff, unwilling to move. The bursa may rupture and infection may spread, leading to formation of abscesses. The pus that is discharged moves along the line of least resistance, and may open out through a number of sinus-like openings on the skin near the poll. The skin is thickened indurated around these sinus openings. The suppuration may spread onto ligamentum nuchae, and cause necrosis of that structure. Prognosis. Poll-evil can be cured if treated early. If neglected, the necrosis may spread causing arthritis of the intervertebral joints. The suppuration may extend to the spinal cord causing death. Treatment. The bursa and surrounding dead tissues are removed. The operation is done under general anesthesia. Make a 6-inch long incision commencing from the poll backwards, on the superior aspect of the neck. Sever through the funicular portion of the ligamentum nuchae behind the necrosed part. Dissect and reflect it forwards and detach from its insertion to the occipital crest. Remove the necrosed tissues adherent to the bone by scraping and corretting. The bone surface may then be touched with caustics if necessary. Bleeding is fairly severe during the operation and will have to be controlled. The important vessels are the ascending branches of the occipital arteries. After removal of dead tissues, the wound cavity is packed with sterile gauze and the skin incision is sutured from behind, leaving a small space anteriorly for drainage. The gauze packs are removed 24 to 48 hours later and the wound is subsequently treated in the usual manner. It may take 6 to 8 weeks for healing. For the first few days after the operation there may be a tendency for the head to drop down because of the severance of the ligamentum nuchae, but this deformity gets connected in due course by the compensatory action of the cervical muscles.